We've been talking a lot about internal rotation, specifically at the glenohumeral joint. Okay, but as we know in any sport, in any motion in life, you're not just moving at one joint. Everything is a multi-joint movement. And we think about the shoulder, we have the glenohumeral joint. We also have the scapular thoracic joint, which is just the shoulder blade that lies on the ribs here. So as we move our arm, our shoulder blade is moving on that rib cage. Okay, we also have the clavicular joint, okay, or the costoclavicular and then the acromioclavicular. So that just pretty much means where our clavicle attaches to our sternum, also where our clavicle attaches to our AC or acromion over here, which is a part on our shoulder blade as well. Okay, those are the motions that are mainly involved with any overhead motion. Okay, there's other joints involved. Our thoracic spine moves, which contains a lot of other joints. We also typically have some sort of neck or cervical motion as well to help balance that out. So whenever we're looking for improved range of motion in our shoulder, whether it's internal or external rotation, we want to make sure we're not just working at that joint. Okay, we can test that area, see if that specifically at that joint if you have limitations, or you can start to look and think of all these other joints involved locally, but then also globally. Okay, one area that's often neglected in thoracic and shoulder mobility is the thoracic spine. Okay, the thoracic spine plays a very significant role, and one way you can test this on yourself is just if you sit up nice and tall, raise your arms up, good range of motion. Okay, however, if you slouch down here, go in your worst sitting posture of all time, not moving far here. If I'm here, limited ranges and all of these things. So we want to make sure we have enough thoracic spine mobility to do all these overhead motions effectively and smoothly. So often I'll prescribe a lot of thoracic spine mobility to my overhead athletes or anyone who's having shoulder problems, lacks of range of motion. Okay, my favorite exercise, or one of them, is definitely the foam roll across the thoracic spine, which can help relax the paraspinal muscles that can cause tightness in that mid-back. If we think of all our sitting, our poor posturing, these muscles just get stretched and stretched, and they get tensed and tense and prevent that thoracic spine from moving properly. Okay, this can really impede our butterfly breaststroke motion in swimming, but also if we have a pitcher coming in, a volleyball player, any of these athletes that have these overhead motions, we're not going to be able to move well. Okay, or if you're just sitting at work on your desk, mousing around here, once again, poor posturing over time can create a lot of tension there, prevent our shoulder from moving properly, and potentially cause symptoms, and if not symptoms, just impair normal function, normal movement, healthy movement. Okay, so for this one, what you're going to need is a foam roll. Right now we're just using a black or a high density foam roll. You can use that or even a white one, which is a little less aggressive. Tailbone on the foam roll, head on the foam roll, hands on the side, rolling back and forth. Okay, this one should feel very good, okay? Not like some of our other mobility where you have tears flying down your face. This one is very relaxing because we're trying to actually release tension in our paraspinal muscles. We're also mobilizing, applying a little rotational mobility to our spinal segments. Okay, so we're getting some rotation there. And there's one last and very important aspect we're trying to do is actually try and release tension on our sympathetic or our fight or flight nervous system. Okay, this system has its origins or its main nuclei right in the front of the ribs, okay? And on the ribs and on the thoracic spine. So if we can mobilize, get some more blood flow, release some tension there, the idea is that we can help support this system, relax it a little, and relax the whole body, bringing down that fight or flight system that a lot of athletes are constantly in, and just our society's in now with all our technological devices, all our blue screens keeping us up all night, and all our excessive coffee that we're drinking, or maybe even beetroot juice if we're trying to get that nitric oxide or NO-explode boost. Okay, so this is a great mechanism, or a great exercise for those three mechanisms. It can really help out in shoulder mobility, shoulder pain, and any other dysfunction in that area. This is something to consider if you have an athlete or person with tight thoracic spine. Thank you.